The war on drugs is failing. It's a global problem with devastating consequences. Millions of people are addicted to drugs. Countless lives are lost each year. Governments spend billions on fighting drugs, but the problem persists. Why? Because we're fighting the wrong war. We're treating a health crisis like a criminal one. This approach has led to mass incarceration, it has fueled violence and instability, and it has done little to reduce drug use. We need a new approach, one that prioritizes public health and human rights. We need to treat addiction as a disease. We need to offer support, not punishment. And we need to invest in prevention and treatment programs. It's time to admit defeat and find a better way. The modern war on drugs began in the 1970s. US President Richard Nixon declared drug abuse public enemy number one. He launched a massive campaign to eradicate drugs. This included stricter drug laws, increased funding for law enforcement, and a focus on criminalization.
Nixon's war on drugs had a global impact. Many countries adopted similar policies. They increased penalties for drug offences, they poured resources into law enforcement, and they embraced a prohibitionist approach.
These policies had unintended consequences. They led to mass incarceration, particularly of minority communities. They fueled the growth of powerful drug cartels, and they did little to reduce drug use. Decades later, we're still grappling with the legacy of Nixon's war on drugs. For decades, the dominant response to drug use has been punishment. We've locked people up for possessing small amounts of drugs. We've given out harsh sentences for drug-related offenses. But has this approach worked? The evidence suggests it hasn't. The US, despite its harsh drug laws, has one of the highest incarceration rates in the world. Many of these prisoners are serving time for non-violent drug offenses, but prison doesn't address the root causes of addiction. In fact, it often makes the problem worse. People in prison often lack access to treatment and support. They may leave prison with limited job prospects and a criminal record. This makes it harder for them to reintegrate into society and avoid relapsing. Punishment alone is not the answer. Addiction is a complex disease that affects the brain. It's not a moral failing or a lack of willpower. Like other chronic diseases, addiction requires ongoing treatment and management. Treating addiction as a crime only exacerbates the problem. It stigmatizes people who use drugs, it creates barriers to seeking help, and it fails to address the underlying causes of addiction.
We need to shift our approach from punishment to treatment. This means expanding access to evidence-based treatments like medication-assisted therapy and counseling. It means providing support services like housing and job training. And it means creating a system that treats people with compassion and understanding.
Section 5. The Drug Cartels. A look inside a shadowy, powerful world. This section delves deep into the clandestine operations and the immense power wielded by these criminal organizations. The illegal drug trade is a multi-billion-dollar industry, generating enormous profits that rival the GDP of some small countries. It's controlled by powerful criminal organizations known as drug cartels. These cartels are not just gangs, they are sophisticated networks with hierarchies and vast resources.
These cartels operate across borders, trafficking drugs and engaging in violence and corruption. Their reach extends into multiple countries, making them a global menace. The war on drugs has inadvertently strengthened these cartels. Efforts to curb drug production and distribution often lead to more violence and more sophisticated methods of operation.
Prohibition creates a black market where demand for drugs remains high. This underground market is lucrative, attracting more individuals to the trade. This allows cartels to profit immensely from the illegal drug trade. The risks are high, but so are the rewards, making it a relentless cycle.
The cartel's influence extends far beyond the drug trade. They infiltrate political systems, using their wealth to sway elections and policies in their favor. They undermine governments, destabilize regions, and fuel violence. The social fabric of many communities is torn apart by the pervasive influence of these cartels.
Their vast wealth and resources make them formidable opponents in the fight against drugs. They can afford the best lawyers, bribe officials, and maintain private armies. Addressing the root causes of drug demand and reducing the profitability of the illegal drug trade is crucial to weakening these criminal enterprises. Efforts must focus on education, economic opportunities, and rehabilitation to create a sustainable solution.
Section 6. Success Stories: What Works When We Ditch the War on Drugs. In this section, we will explore the transformative impact of shifting away from punitive measures and embracing more compassionate, evidence-based approaches to drug policy. Some countries have recognized the failures of the war on drugs and have adopted alternative approaches. These nations have shifted their focus from criminalization to public health, aiming to reduce harm and support individuals struggling with addiction. Portugal, for example, decriminalized all drugs in 2001. This groundbreaking move was driven by the realization that criminal penalties were not deterring drug use and were, in fact, exacerbating the problem. Instead of arresting and incarcerating people for drug possession, they focus on treatment, harm reduction, and social reintegration. This holistic approach aims to address the root causes of addiction and provide comprehensive support to those in need.
Switzerland implemented a heroin-assisted treatment program in the 1990s. This innovative program was designed to help individuals with severe heroin addiction who had not responded to other treatments. This program provides supervised heroin injections to people with severe heroin addiction who have not responded to other treatments. By offering a controlled and safe environment, the program aims to reduce the risks associated with illicit drug use.
These alternative policies have shown positive results. Countries that have adopted these approaches have seen significant improvements in public health and safety. Portugal has seen a decrease in drug-related deaths, HIV/AIDS infections, and drug use overall. The decriminalization policy has also led to a reduction in the stigma associated with drug addiction, encouraging more people to seek help. Switzerland's heroin-assisted treatment program has led to reductions in crime, improved health outcomes, and increased social reintegration. Participants in the program have reported better quality of life and greater stability. These examples demonstrate that alternative approaches can be more effective and humane than the traditional war on drugs. By focusing on treatment and support rather than punishment, we can create healthier, safer communities and offer hope to those affected by addiction.
Section 7. Follow the money. Who profits from the illegal drug trade? The illegal drug trade is a lucrative business. It generates billions of dollars in profits each year. But who benefits from this illicit industry? The answer is complex and multifaceted.
Drug cartels, of course, reap the lion's share of the profits. They control the production, trafficking, and distribution of drugs, but their wealth often comes at a high cost, fueling violence, corruption, and instability.
However, the flow of money from the drug trade doesn't end with the cartels. It seeps into legitimate economies, often through money laundering schemes. Banks, businesses, and individuals may unwittingly facilitate the movement of drug money. This creates a complex web of financial interests that can perpetuate the drug trade.
Section 8. Breaking the Stigma. How Society Can Help, Not Judge. In today's society, the stigma surrounding drug use is pervasive and damaging. It affects not only those who use drugs, but also their families and communities. The war on drugs has fueled a stigma against people who use drugs. This has led to a culture of fear and misunderstanding, where individuals are often judged harshly without understanding the complexities of addiction. They are often viewed as criminals, morally flawed, or a burden on society. This negative perception can lead to isolation, shame, and a reluctance to seek help. This stigma creates significant barriers to seeking help, accessing treatment, and reintegrating into society. Many people fear judgment and discrimination, which can prevent them from reaching out for the support they need.
We need to break down the stigma associated with drug use. This involves changing our language, attitudes, and policies to be more compassionate and understanding. This requires a fundamental shift in how we view addiction. Instead of seeing it as a moral failing, we need to recognize it as a complex health issue that requires comprehensive care and support. We need to recognize it as a health issue, not a moral failing. Healthcare professionals, policymakers, and community leaders all have a role to play in this shift.
Education and awareness campaigns can help challenge misconceptions about drug use and addiction. By providing accurate information and sharing personal stories, we can foster empathy and understanding. Creating supportive environments where people feel safe seeking help without fear of judgment is essential. Support groups, community meetings, and open dialogues can make a significant difference. Breaking the stigma is crucial to creating a more humane and effective approach to drug policy. By working together, we can build a society that supports recovery and respects the dignity of all individuals.
Section 9. A new path forward. Why we need a smarter approach to drugs. The war on drugs has failed. It's time to admit defeat and chart a new path forward. This new approach must prioritize public health, human rights, and evidence-based solutions. We need to treat addiction as a health issue, not a criminal one. This means expanding access to treatment, harm reduction services, and support networks. We need to invest in prevention programs that address the root causes of drug use. We need to decriminalize drug possession and focus on diverting people away from the criminal justice system. And we need to break down the stigma surrounding drug use and create a society that supports recovery. It's time for a smarter, more compassionate approach to drugs.